Hello, I am speaking to you today from Stockholm, Sweden. I'm your host at AI Health Lab. What is important is my work. I am a master's student in the AI for Health program at Stockholm University. Here, amidst the quiet hum of servers and the thoughtful discussions in our labs, we are exploring the future of medicine. The world of healthcare is facing immense pressure. This is a reality for people everywhere. Many individuals feel unwell or live with the constant worry of potential illness. They might be managing chronic conditions like diabetes, heart disease. Others find themselves waiting to see a specialist to receive a diagnosis. This waiting is not just an inconvenience. It is a period filled with anxiety and uncertainty. The systems we rely on are strained. So, what exactly is medical AI? It's a term we hear more and more, but its meaning can sometimes feel abstract or even intimidating. Let's break it down into its fundamental components to truly understand its power and its purpose in modern medicine. At its heart, medical artificial intelligence is a collection of advanced computer methods. Think of it as a specialized branch of computer science focused entirely on health and biology. These methods are meticulously designed to learn from vast and diverse collections of health data. This isn't about simple programming with fixed rules. It's about creating systems that can teach themselves. These methods, often called algorithms or models, are trained to identify complex patterns. An algorithm is like a recipe, a set of steps for the computer to follow. When we train it with data, it evolves into a model, a sophisticated digital structure that has learned to recognize specific features within that data. The goal is to find connections and correlations that a human observer might not easily detect, not because of a lack of skill, but due to the sheer volume and complexity of the information. For instance, it can interpret medical images like X-rays, and it can interpret medical images like CT scans, spotting subtle textures or shapes that might indicate disease. Beyond images, it can read through doctors' notes and patient histories, extracting key information from unstructured text. It can also analyze numerical data from lab tests, tracking thousands of variables over time to see how they interact. By finding these hidden patterns, AI can help with tasks like predicting a patient's risk for a certain disease long before it becomes clinically apparent. It can also help in suggesting potential treatment options, personalized to an individual's unique genetic makeup and lifestyle. It is helpful to think of AI as a very diligent and incredibly fast assistant for medical professionals. It's a collaborator that can process information at a scale and speed that is simply beyond human capability. For example, in breast cancer screening, a radiologist's work is demanding and requires immense focus. Now, imagine an AI that can review thousands of mammograms overnight and flag the few that show suspicious characteristics for a radiologist to review first when they start their day. This doesn't mean the AI makes the diagnosis. That critical step remains firmly in human hands. Instead, it means it helps prioritize the doctor's attention on the most urgent cases, acting as a powerful second pair of eyes and reducing the chance of missing something subtle. This is a crucial point. AI is a tool for augmentation, not replacement. It enhances a clinician's abilities, but does not replace their expert judgment, their years of experience, or the essential human element of empathy. Let's take another concrete example. An electrocardiogram, or ECG, is a common, non-invasive test that records the heart's electrical activity. For over a century, doctors have interpreted these waveforms to diagnose cardiac issues. Now, an AI model can be trained on millions of ECGs from a diverse patient population, learning to recognize the incredibly subtle signatures of various heart conditions. It can analyze a new ECG in seconds and alert a doctor to early signs of a potential heart attack or an arrhythmia, sometimes even before the patient feels severe symptoms. This shifts the paradigm from reactive treatment to proactive prevention, opening a window for early intervention that could save a life. The AI isn't just seeing the present, it's helping predict the future, My work here at Stockholm University, specifically within the Department of Computer and System Sciences, is deeply immersed in this world of AI-driven healthcare. Stockholm itself is a vibrant hub where technology and life sciences intersect, creating the perfect ecosystem for the kind of research we do. It's a city that fosters innovation, and our lab is a direct reflection of that spirit. I am part of a uniquely collaborative environment, a place where the lines between different disciplines blur. My research isn't confined to a single room. It's a journey that takes me from our high-performance computational labs, where the algorithms are born, directly into real-world clinical settings, where their true value is tested. This constant movement between theory and practice is fundamental to our approach. It ensures our work remains grounded, relevant, and genuinely useful. This work is impossible to do alone. Our team is a mosaic of expertise, bringing together brilliant computer scientists who design the core architecture and meticulous data engineers who build the pipelines that feed our models. We work hand in hand with experienced medical doctors who provide invaluable clinical insights, and most importantly, with the patients themselves, whose perspectives ensure our solutions are designed with empathy and for real human needs. Our shared focus is on developing AI tools that are not only powerful, but also transparent, safe, and equitable. These aren't just buzzwords for us. They are the pillars of our research. We are not just building algorithms, we are trying to build trust. Trust from clinicians that the tool is reliable, and trust from patients that it is fair. In the lab, a typical day involves working with vast, carefully anonymized datasets. We're talking about thousands of medical images, like mammograms or retinal scans, and millions of electronic health records. This data is the lifeblood of our work. We use it to train our AI models through a process that is highly iterative. For instance, we teach a model to recognize the subtle, almost invisible patterns that signal the early signs of diabetic retinopathy. We refine it, tune its parameters, and challenge it again and again. Then, we test the model on a completely new set of data it has never seen before. This is the moment of truth, where we see how well it can generalize its learning to new, unseen cases. But performance in the lab is only half the story. In the clinics, we conduct rigorous usability studies. We observe how doctors and nurses interact with these tools in their workflow. Is it helpful? Is it intuitive? Does it integrate seamlessly, or does it add to their burden? And critically, does it support and promote fair, unbiased decisions for every patient? This feedback loop is what turns a clever algorithm into a life-saving tool. Welcome to the AI Health Lab. This channel is designed to be your trusted guide through a landscape that can often feel overwhelming. We're here to cut through the noise and the hype. Our mission is to translate the complex, rapidly evolving world of artificial intelligence in health into simple, understandable, and actionable concepts. We believe that knowledge is the first step towards empowerment, and our goal is to provide you with a clear and accessible pathway to understanding. To ensure every topic is easy to follow, we've designed a consistent structure for each episode. Every exploration will be broken down into 5 short, focused chapters, much like the one you're watching now. This modular approach allows you to learn at your own pace, fitting these insights into a busy schedule. We always begin with step 1, the problem. Here, we'll define a real-world challenge in healthcare that needs a better solution. Then step 2, the AI idea. We'll introduce a specific artificial intelligence concept that could potentially address this problem. Step 3 is research. We'll look at the current scientific evidence and studies behind the AI idea, exploring what we know and what we don't. This leads to step 4, action steps. We'll provide practical, tangible takeaways tailored for different audiences. And finally, step 5, the future view. We'll look ahead at the long-term potential, the ethical considerations, and what to expect next. This 5-step format is intentional. It creates a logical narrative, allowing us to explore one core idea at a time and build your knowledge comprehensively, step by step, without leaving anyone behind. To support this clear structure, we use a clean and minimalist visual style. You'll see footage from our labs and the beautiful cityscapes of Stockholm, complemented by simple diagrams and animations that are designed to be intuitive and easy to digest. Our goal is to create a calm, focused learning environment, a space where you feel empowered by new information, not overwhelmed by it. This content is for a diverse audience because the future of health affects us all. Whether you are a student, a patient navigating your own health journey, a healthcare professional on the front lines, or simply anyone with a curious mind, there is something here for you. In our Action Steps chapter, we'll offer simple, actionable tips specifically for each of these groups, ensuring the knowledge you gain is relevant and applicable to your life. Clarity is our promise to you. We are committed to using plain language, and whenever a technical term is necessary, we will pause to explain it clearly. Our aim is to make this journey into AI and health an enlightening one for everyone. The future of health and wellness, guided by artificial intelligence, holds considerable promise. It is easy to envision a world where AI helps healthcare become proactive rather than reactive. Imagine AI systems that can help detect diseases like cancer, Alzheimer's, at their earliest, most treatable stages, long before clear symptoms appear. Picture a future where AI helps doctors personalize treatments, analyzing unique genetic makeup and lifestyle to choose the most effective course of action. This could make care more effective, faster, more efficient, and more equitable for everyone. We must proceed with caution and thoughtfulness. Protecting patient privacy and ensuring the security of sensitive health data must be our highest priority. We need continuous feedback, listening to patients and clinicians. We must make these AI tools accessible in cities and remote communities alike. Technology is a tool to enhance human care, not to replace it.